everybody, Todd Thoughton here from Thoughton Physical Therapy. Excited to be back again for another session of Ask the PT. This is one of my favorite topics, talking about plantar fasciitis. And I'm here as always with Alana. Excited to have both of us back here again tonight to bring everything that we can offer. So just a little bit about me. I'm a physical therapist. I've been a physical therapist for over 20 years. And my passion is working on people's mindset with their injuries, as well as their physical person and their injuries that they have. I enjoy working out. I've been a triathlete for many years. So a lot of these injuries and a lot of things that I'm talking about today are things that I've treated. I've treated pretty much everything that I've been talking about, but also I can see both sides from the patients that come in and just getting some feedback over my time. So because I'm only able to treat patients so many visits a week, I wanted to add more value. So how I decided to add more value was to have a bigger reach with people. So then I came up with Ask the PT. So tonight's topic, I'm really excited to talk about it. It's one of my favorite topics to talk about is plantar fasciitis. Many people have had what they consider plantar fasciitis. Their friends may have had it, runners. There's many people that do get it, and it's a very, very frustrating injury. Just to give you a little background of my thoughts on that. Again, this is just through my eyes. Over the last couple of weeks, we've talked a lot about the lumbar spine and the fuse box. So I just want to orientate us again to the lumbar spine. So one of the things that we talk about in terms of the fuse box is that all motion should be originating along the core. And any symptom that we're talking with, any injury in the low body, I believe through my experience is caused by 100% of the time, is caused by or started in the lumbar spine or the glute muscles. So we have the 5 lumbar vertebrae, L5, L4, L3, L2, L1. And then we also have the nerves that come out on each side. And we know the nerves do 3 things, basically 3 things. They allow a pain response, so they can send a pain response all the way anywhere down into the leg. They allow sensation changes. They allow us to tell if something's hot or cold, numbness or tingling. And they also give enough juice to the muscles to work. Hey, Shelley. And what happens over time, if those nerves are pinched for whatever reason, there's many reasons that this can happen from a physical therapy standpoint, but if those nerves are pinched for any reason, it can give you pain sensation. It can give you just sensory changes, numbness and tingling. It can also give you a decrease in the juice or the power to the muscles to work in the lower body. So the lumbar spine is a very, very important piece. Again, to orientate us over here on the back of the spine. So there's 5 lumbar vertebrae, and then there's also 5 sacral vertebrae in the spine over here. There's S for sacral, S1, 2, 3, 4, and 5. But these are all fused. But we also have nerves that come out of them that also go down to innervate the low body. The low body is basically innervated by the 4th, the 5th lumbar, and some of the sacral vertebrae. So just keep that in mind. I actually have found over the years that I've been working with many patients with plantar fasciitis, less than 10, probably even 5% of the people actually have true plantar fasciitis, and all of them have a component with the low back. I don't remember the last time that I actually treated plantar fascia issues, because if I can treat the lumbar spine and everything up above, it really makes a big difference. I'm going to orientate us to a few different muscles in the low body. So of course, we're going to start off with the glute muscles. So the glute is the big muscle in your bottom, okay? Then we have the glute medius muscle, which is a muscle on the side of the hip, over here on the side. The glute medius muscle can send us referred pain through a trigger point, can give us referred pain all the way down to the foot, which can simulate plantar fasciitis. So if we do a trigger point release, that is one of the areas that we can change the symptoms of the plantar fascia. That's why the glute medius muscle is so important. The lumbar spine also, if we mobilize the lumbar spine, that can also relieve some tension or can cause some of the tension all the way down into the foot. So the other muscles that we're going to talk about next are the gastroc. So if you look at our calf muscle, the calf muscle in the back, there's 2 different muscles in your calf. The first one is the gastroc, the one that we see the 2 heads in it. If we're wearing a pair of shorts, we see the 2 heads. The gastroc attaches up just above your knee to the femur, which is the large bone in your leg. And then it comes down to form the Achilles tendon and attach at your heel. So the job of the gastroc has a ankle portion, but also has a portion where it flexes the knee. So the gastroc helps us push off, helps us point our toes. That's the gastroc. The second muscle that we have is called the soleus muscle. And the soleus muscle attaches at the fibula on the lower part of the leg and goes deep, kind of behind the gastroc, also comes down and forms the Achilles tendon, which also attaches in the heel. That muscle also is involved with helping to point your toe as well. And has some, it helps turn both of the gastroc and soleus help to turn your ankle in and out a little bit as well. Those are two really important muscles. So a lot of times people that have tight calves, they can start to develop some ankle pain or some plantar fascia pain. The other muscle that we're going to have, one of the other ones is called the anterior tibialis, which is the shin muscle. The shin muscle is very important. A lot of people say that they have shin splints. That could be another topic that I'll probably talk about sometime as well. But the anterior tibialis is the muscle in the front. That's the one that's responsible for pulling your foot up. Then we have the posterior tibialis, which is a muscle in the back of the, which is in the back of the calf, which also helps to point your foot down. So there are a few different muscles in the lower body that are really involved with the mechanics of how the body moves. Then the most important one that we're going to talk about tonight is the plantar fascia. So here's a model of the foot over here, and just to orientate you, this would be the tibia, the shin bone. We have the fibula, which is the small bone. Then we have the heel, which is called the calcaneus. If I was to turn it on its side, the plantar fascia runs from the bottom of the heel and splays out to all the toes. So it's a piece of connective tissue that helps to form the arch of your foot. So when we stand up, it's on some tension. So the question is, what is plantar fasciitis? That's the million-dollar question. Plantar fasciitis, anytime we hear itis, it means inflammation. So plantar fasciitis is inflammation of the plantar fascia on the bottom of the foot. So what does that mean? A lot of times, anytime we have an itis, whether it's a tendonitis, we get a type of overuse. And when we get an overuse, just like if we're going to build some muscle on our own body by working out or doing some strength training, whenever we work a muscle, then we tear some muscle fibers down. Once we tear the muscle fibers down, we have to give them enough time to heal. Then they get stronger and bigger through having a great nutrition plan. They heal and they get better. The problem with plantar fasciitis is that the plantar fascia gets irritated, gets rubbed, it gets irritated, but it never really heals. And then we get the chronic irritation. Chronic irritation, we get some more scar tissue built up, and then you get a lot of pain. It elicits a lot of pain for the person. What are some of the subjective symptoms that a patient might come in to say? A lot of times someone will come in and say, the bottom of my foot really hurts. I feel like I have a tack. I feel like I'm stepping on a tack on the bottom of my heel. They also have pain on the inside of the heel. They can have pain in the whole surface of their foot. They can have pain in the big toe. There's many different areas that the patient can notice where they're going to have symptoms. Other things that they might say is, it bothers me first thing in the morning. It bothers me first thing in the morning when I get up out of bed and when I take my first couple steps. Very commonly, plantar fasciitis, when you start walking, it does get a little bit easier to walk, things loosen up. Patients also complain that towards the end of the day, it can bother them as well. A lot of times if someone goes and sits down, when you go to stand up again, they get the same types of symptoms, that the heel pain at the bottom of the foot. What may I or other physical therapists see objectively when someone comes in with plantar fasciitis? Again, through my eyes, by thinking about the fuse box and how the body works, that I'm always going to go check out the lumbar spine first. And I can say, because the nerves, we have nerves that run on each side of the body. If I had pain on one side, I can rest assured that, again, with almost 100% certainty, that patient, the lumbar spine, the vertebrae that we talked about, are going to be tender and sore on that side of the body. So that's the first thing I'm going to do, is I'm going to check out the lumbar spine and see if I can correlate anything with that to symptoms down the leg. I'm also going to check out the glute muscles to see if the glute muscles are if they're working properly on that side. And again, in almost every person that I see, the glute muscle on that side is not working. Then I'm going to check out the glute medius muscle, the one that I was talking about on the side of the hip. That's usually weakened and spasm. Then I'm going to follow by checking out the core muscles. I'm going to check out the core strength that they have in the lower abdominal muscles. So now I've checked out the low back, I've checked out the core abdominal muscles, then I'm going to work my way right down the chain. I'm going to check out the hip, I'm going to check out the knee, and the last thing I do is check out the foot. A lot of times, even during the evaluation, when I do the evaluation, I will notice that once I've worked on some ability of the lumbar spine, ask them to engage the core, ask them to engage their fuse box, because remember what do nerves do? One of the third things that they do, one of the three things that they do is they give us pain sensation to a specific part of the body. So if I work on the lumbar spine, almost all the time I'm going to alleviate pain in the plantar fascia. Then I want to start to activate the muscles in the low back. And by activating the muscles in the low back, I'm now sending stronger impulses for all the muscles, the leg muscles to work a little bit better. That will also decrease the symptoms. So now I've looked at the low back, I've looked at the glute muscles, I've looked at the hip, the knee, and now I'm going to check out the plantar fascia. So what I'm looking for is to see if there's going to be any tenderness in the calf muscles, the gastroc muscle, the soleus muscle, and again, the last thing I'm going to check is the plantar fascia. So what would be a typical treatment for someone with plantar fasciitis? Well, the typical treatments when people come to see me in the office, if they've already tried something else, they've already been told try ice. They've already told to try heel certs or orthotics. They've been told to try the nice splints. These are all really, really good things that very, very common if you go on the web. I found when I ask a patient to rest, the patient is going to get more deconditioned and more aggravated because they can't do things. To me, rest is never the answer. We need to find out what is the source, and I'm going to say with 100% certainty, it's all going to start in the lumbar spine. So if I've tried rest, it doesn't work. Of course, you're frustrated because that's really not the area that we want to start with. Then people say, well, I've tried orthotics. Again, going along with the fuse box theory that I've been working on, we have to initiate and originate all motion from the lumbar spine and from your core. If we initiate and treat something from the plug, if we think the fuse box powers the plugs in a house, if we go and we initiate treatment with orthotics, we're working from the plugs. That's probably not, that's just treating a symptom of what could be going on up over here. I think that after you've cleared the lumbar spine, we've worked the core is nice and strong, the symptoms are less, that's when I would be looking at orthotics, certainly not to start off with. People work on, they also say that they try night splints. When I have a night splint, what the night splint does is it holds you in a position when your ankle is flexed up as if to stretch your calf. The problem with night splints are if it's a nerve-related injury, something coming from the low back, we're tensioning the nerve all night long. Although it might feel good for the first couple steps, a lot of people do get worse, or they're just not making enough progress. So commonly, people will look at surgery. Commonly, the next thing people might do is try cortisone shot. Cortisone shot can be helpful because the plantar fascia is irritated, but that's really not what the cause is. It's a symptom of something coming up, starting up in the lumbar spine. And the last thing, hopefully, most people don't need to do is surgery. That would definitely be something that it would be an absolute last resort. And usually surgery would be to loosen up the plantar fascia if it's really tight or if the person has a heel spur. So those are all the common treatments. So what I tend, through my eyes, through my years of being a physical therapist, is I'm going to start with the lumbar spine. Actually, I'm going to start with the thoracic spine. I'm going to start with the mid-back. The mid-back mobility, if it's not mobile, the lumbar spine can't do its job. So I'm going to start with the mid-back. I'm going to work on the mid-back mobility. Then I'm going to work on the lumbar spine. I'm going to make sure the lumbar spine and the low back is moving well, moving efficiently the way that it should. Then I'm going to get right in with some stability exercises of the lumbar spine. The next thing I'm going to do is I'm going to work on the SI joint, which is where the sacrum meets the ilium in the low back. I'm going to check and work out the SI joint. I'm going to assess and treat that as needed. The next thing I'm going to do is I'm going right down the chain again. I'm going to assess the hip. I'm going to assess the hip mobility, and I'm sure that they have a weak glute medius on this side. I'm going to assess trigger points over here on the side of the hip that are definitely going to make a difference. The next thing is I'm going to check out the knee. I usually, for the years that I've been doing this and working on just a different theory lately, is that I don't even usually have to get past the hip. Once I treat the hip, once I treat the low back, the hip, the core muscles, that is usually enough to clear up 70 to 85 to 90% of the plantar fascia issues. But if that's not the case, and if I need to do a little bit more work, then I'm going to go check out the calves. I might do some KT taping of the calf to take off some of the pressure. And then the last thing I'm going to do is I'm going to go check out the plantar fascia. So that is those are in my words, or how I see that I would treat plantar fasciitis. So again, the most important thing is I would be looking up above. Hey Emily, how's it going? If you've been watching the videos, it's kind of the same pattern that I've been seeing over the many years. This is where it has to start. We need to start in the lumbar spine first. So we have a couple questions that people have written in. So I'm going to go over a couple questions. I have plantar fasciitis soaks and my PT shaved down the calluses. I'm in a great deal of pain. Is this normal? What else could I do? I would imagine that, so whenever someone has any injury in the low body, for whatever reason that is, it's likely a lot of people have calluses on their feet. Well, first of all, thank you for the question. Great question. A lot of people do have calluses on their feet, and when they do have calluses on their feet, it's a symptom of something else. As long as they've cleared your low back, as long as they've cleared your hip, as long as they've cleared and make sure you're on a really good core conditioning program, and you mechanically, everything is the way that it should be and working really well and efficiently, and your pain is lessened, now we're just dealing with a callus, then I might address the callus issue. But if we start from the callus issue, thinking with the fuse box theory, if we start with the callus issue, we're starting at the plug, which is just violating how we should normally do things. So if we work the calluses first and then address up over here, the calluses are going to come back. I would say, hopefully that's helpful for you. I think there are definitely some other options. I would definitely hesitate on removing calluses only as a last resort. That's a great question, though. I'm sure you're not the only person that has that question. The next question is, what kind of orthotics do you recommend for pain in my big toe? Through my eyes, again, I would be, once I would clear the lumbar spine, once I clear the hip, and once I clear everything else that we've just talked about, that should clear up most things, and I'm not thinking that you would even need a pair of orthotics. Other things that I would assess, sometimes the ankle doesn't move very well, and that would mean that the big toe doesn't move very well. So I would check the mobility of your ankle, and then I would check the mobility of the big toe, knowing that we're already starting to work on the core stabilizing muscles. So again, core stabilizing muscles, the fuse box, the low back. Once you've cleared all that and you're on a great program, I would check out the mobility. The last thing would be the mobility of the ankle, make sure all the toes are moving well, and then I would take it from there. And then if you need orthotics after that, I would have someone evaluate you at that point. We have a question from Shelley. Thank you for the question, Shelley. I have arch pain, and I have tried many different pairs of running sneakers and orthotics, but I've not found a pair that works for me. What can you suggest? Thank you again for the question. That's a great question. I'm going to answer on, since we kind of just talked about the orthotic piece, I'm going to talk on the running sneaker piece, or any footwear for that matter. Nowadays, running shoes, if you're a runner or even just a walker, any activity you do, sneakers can be anywhere from $100 to $160. So that is a big investment to make. The first thing that I would do, and then we have all sorts of shoes. There are stability shoes. That's definitely not my expertise. But what I do know is, like we've talked about today, is any issue with the foot is usually a symptom of something up the chain. So I would go to a physical therapist or go to your doctor to get your low back checked out, make sure you're on a good strength conditioning program, make sure you've assessed any core weakness that you have. And a lot of people that run, I'm also finding that athletes are even harder to work with because of their athletic skill. They've already bypassed a few things. So I kind of have to take it down a couple notches with their conditioning program and find out really where is their starting point, where we need to start with. So make sure you're on a good core strength and conditioning program. Make sure that you're consistent, because it only takes, this is another big thing. The things that I have been working on for the last couple of years, they're not flashy. They're really, really simple changes that need to be made, but it's like a compounding effect, only 1 to 2% change consistently done over time. So you really got to make sure you're putting a good effort in and staying consistent, whether you have a personal trainer or physical therapist who can give you these exercises. You really need to stay consistent. Once you've cleared all that, then I would go take a look at the running. I go to a good running store where they're really educated on what type of footwear you would need. Again, I think make sure you treat the first thing first and then go down to the footwear. And the orthotics is kind of the same thing. I would just try a pair of running sneakers, see how that goes first. Keep with your core conditioning program. And if that's still not working, I would add orthotics in after you try the running sneakers for a while. Awesome question. Thank you. So Patricia's question is, my daughter is a catcher and softball season is here. She is on the balls of her feet. Are there good exercises and stretches to relieve her foot pain issues that you can recommend? That's a great question. I'm going to answer it the best I can right now, but please feel free to reach out to me personally at toddh@houghtonphysicaltherapy.com, toddh@houghtonphysicaltherapy.com. Friend request me on Facebook, and we can have a conversation there to give you a little bit more in depth for your needs. But just to answer your question, a lot of times when we talked about the fuse box theory, and when the body's in perfect alignment, when the head is over the shoulders are over the torso, the body's in the best alignment. All the nerves, the spine is in alignment, all the nerves are working correctly. Your daughter being a catcher, she's slumped over a lot. So immediately, once we go into that slumped over position, she's actually turning off the fuse box. She's turning off the strength possibility to her legs. So she's making all those fine, intricate muscles that she has to be on her toes, the calf muscles and all the muscle on the bottom of your feet, the plantar fascia, they're on strain and stress all the time. So the biggest thing I would say for her, she really needs to work on an upper back strengthening, a low back strengthening, and glute strengthening, as well as a core strengthening program. That has to be rock solid. Even when she goes to catch for a couple innings, in between innings, I would be doing some exercises, like some Superman exercises, some core activation exercises, because that's going to be turning everything on, which is going to make it so one side of her body isn't going to be overworking itself. So again, that's where I would start with, is a core conditioning program, make sure she's doing that rock solid. I would also, I would make sure that her joints are really as flexible as they need to be. I'd look at the mobility of her ankles, and I look at the mobility of her toes. Make sure she has a good footwear as she can for being a catcher. But that's definitely where I would start. So if she's doing that all the time, in between games, she won't be stressing it as much. But again, if that doesn't answer your question, I would love to talk with you more. So please feel free to reach out. Actually, one of the things, so my friend Joanne, I just wanted to share, and I checked with her, she said it was okay. So my friend Joanne called me up just about a month or 6 weeks ago, and she said that her daughter was having some pain, I believe in her knees. She's a really active young woman. She's an adolescent. It's really tough to tie down. She's really active. And when I was talking to Joanne, Joanne said that she was having plantar fascia pain. She said she'd been going to physical therapy with making really, really small results. So I had her come down on a Sunday because Liv and her family, they have a really busy sports schedule, like pretty much all of us, anyone that has kids nowadays do. I had her come down to the clinic, and we spent some time on a Sunday afternoon. And what I found with both her daughter, Liv, and Joanne, is that they both had weakness on the same side of the body where they were having the related symptoms. So going along with the fuse box theory, for Joanne's job, she might spend a lot of time sitting or a lot of time driving, so she's shutting off things, and she's not getting enough juice to the muscles to have them nice and strong. So I just got a text from Joanne, so I gave her a couple simple exercises. Her and Liv, I gave them the same exercises, even though they're different problems, because it's the same pattern that I'm seeing all the time. I gave them, if anyone knows what a variation of a dead bug exercise, to activate the core muscles, and also to activate the neck muscles and the core muscles. And then I had them do a Superman exercise to activate the glutes, activate the scapula depressors, the shoulder blade muscles, and also the neck. So this is the text that I just got from Joanne today. She says, "Hi Todd, I saw your announcement for tonight's Facebook Live topic and just want to give you an update on our progress. Not only do I feel 2 inches taller and, and I feel lighter after doing the exercises for a few weeks, but I can pedal my exercise bike and do stairs at lunch without pain. I have gone from a 6 on the pain scale to a 2 on good days. Thank you." She said, Liv has had a busy schedule. She hasn't had enough time to do a lot of the exercises, but she asked me to send a video, so I'm going to be sending her a video of these exercises. But she's been stable enough to play in the playoffs. In the last 2 weeks, she played in the state championship and they won. So nice job, Liv. So the reason why I wanted to share that with you is I gave them essentially 3 simple exercises. And they've been doing it, compounding it, doing it every day. Joanne's been doing it very frequently, and I suggest 3 to 4 times a day. It takes 3 to 5 minutes by doing the same consistent exercises, by doing the compounding effect, by doing the same simple exercises, activating the core, activating all the muscles in the body, and I never touched her foot. Again, and she went from a 6 to a 2, and that was just with one time giving her a few things to follow on her own. So I can't stress enough the importance of why the fuse box and working your core for any lower body injury is crucial. My chiropractor told me Pilates was good for core strength. I got a Pilates chair for home. It's helped my pain, mostly my low back. I totally agree. I think that the Pilates exercises are fantastic. The only thing that I caution with the Pilates exercise, a lot of them might be just a little bit too high level for people. So as long as you're not increasing your pain and you really want to watch your form, make sure your form is dialed in, as pristine as you can make it. Because if we miss a couple steps, like as we're building a foundation, it's important to know where we start. So we need to build a nice strong foundation, making sure that your form is right on and making sure you're not having any refer pain. But I think Pilates is amazing. Yeah, so make sure you keep doing that. That's great. My big toe goes numb when I have my feet for a long time at work. What can I do to help that? So the first thing I'd say about your big toe going numb is we need to find out why. Again, thinking that we've cleared I'm not going to go over the whole fuse box thing again, but thinking we've cleared the lumbar spine, cleared the sacrum, we've cleared the hips and the knees. Now we're going to get down to the ankle. So I would want to make sure sometimes there's a little structure on the inside. So, like we talked about carpal tunnel, there's a thing called tarsal tunnel down in your foot, okay? In the tarsal tunnel, there's some nerves and fibers that come through an area on the inside of your foot. That can give you referred pain and numbness down sometimes into your foot. So that would just be another pathology that I would want to make sure, I'd want to make sure that we check that out. But anytime we have numbness and tingling, it's because there's a nerve involved somewhere, and we just need to find out where that is. One of the favorite parts of my job is I get to try and figure out people's issues. One of my passions is, I love when people come to me and they haven't gotten better, just because it really gets my mind going, just to try and figure out where the problem's coming from. So I hope that was helpful for you, and thanks. That's a great question. So just to finish up, thank you everybody for tuning in. I hope this was helpful. Plantar fasciitis is one of my favorite topics because when I first came out as a therapist, I was working on a lot of common things addressing just the foot. So now that I've seen over many years that that's not the place to start, and we need to start up a little bit higher. So again, hopefully this will be helpful for everybody. I really enjoy doing this. This is my favorite part of the week, to start off this way, just to be able to share some of the knowledge and try and add value to anybody out there, add some content. If you have any questions, please feel free to reach out at todd@HoltonPhysicalTherapy.com or personally, private message me on Facebook, however you want to get in touch with me, and I'd be more than happy to talk further on any of these topics that we've talked about. So Alana, thank you again for helping out. She does a great job, and I hope you guys have a great week, and we look forward to seeing you next week. Thank you.